Basic Human Rights Training from Nonotuck Resource Associates. Today we will be talking about what human rights are, why human rights are important, how we ensure human rights, our human rights committees, rights and responsibilities, the rights themselves, and any concerns. What are human rights? Human rights are rights and freedom all human beings are entitled to. These rights are often assumed and sometimes can be taken for granted. They are often moral, social, and cultural norms. Human rights are not necessarily written down, but rather inferred amongst members of society given the patterns and practices of authority figures such as people in higher economical, political, or power structure. Why are human rights important? Human rights are important because they guide the way people act. They make up the basic societal construct of how people are expected to treat one another, and they guide how people should treat themselves as well. Why are human rights important to the people that we support? In part, due to the history of isolation, segregation, and mistreatment of people with disabilities, it is important that we prevent history from repeating itself. It is also important because some of the people we support may not have a firm understanding of human rights, and it is our responsibility to teach and advocate. Lastly, it is important to teach other members of society that human rights are applicable to everyone, including certain populations that at one time seemed less prevalent and visible in society. How we ensure human rights. In order to ensure that the human rights of the people we support are being maintained, there are a few steps that we take. First, we conduct trainings for both the people served and their providers. Often this training is performed annually or as needed. It is also expected that 2 human rights are discussed with the people that we support at each home visit. Finally, our human rights committees. Human rights committees. The Human Rights Committee is a group that meets to review the related discussion topics within the agency. These reviews are to make sure that the rights of the people we serve are being upheld. The committee consists of professionals in a variety of areas, as well as staff from the agency that serve as human rights officers. On the committee, there are professionals from the medical and legal fields, as well as family members of people served and people receiving the agency's supports. The committee meets at least quarterly to review incident reports, medical and behavior plans, and discuss any questions or concerns people may have. The committee members give their input and provide feedback and suggestions surrounding human rights issues. Human Rights Coordinator. Human Rights Coordinator is an employee of a provider agency or appointed by the head of the agency to coordinate and facilitate Human Rights Committee meetings. There's typically 1 Human Rights Coordinator for each agency committee. Human rights coordinators also provide guidance and support to all human rights officers working for the same agency. Human rights officers. A human rights officer is an employee who is officially trained and certified by DDS to teach people receiving DDS services to understand and exercise their human rights. There's typically 1 human rights officer at each program site. Rights and responsibilities. As members of society, we have both rights and responsibilities. Balancing rights and responsibilities ensures that we are treated fairly and respectfully by others, and that we are doing our part to honor and respect the rights of others as well. Access to the courts. The people we support have access to the legal system, including representation. The people we support should be aware of their rights and how to utilize the legal system. Guidance from Human Rights Committee's legal representation may assist in such education. The right to due process. This means that everyone has the right to be treated fairly. Their life, liberty, and property cannot be taken away without proper legal procedure. In specific circumstances, contesting their own guardianship also applies. The right to dignity and treating the people we support with respect. This means do not use a patronizing tone, do not use inappropriate names, do not refer to the individual in your home as a child, use age-appropriate language, do not use threatening language or behavior, respect race, culture, and ethnicity, and treat people we support how you would expect to be treated. The right to dignity, Part 2. Include the person in the conversation about them. Don't talk about someone's challenges or their deficits in front of them. Involve the person in the decision-making process, and respect the person's choices, even if they are not the choices that you would make for yourself. The right to privacy. The people we support have a right to a private life. This includes a place to sleep, a place to store personal items, privacy when taking care of personal needs, in communication such as phone calls, letters, and emails, and as visits as well, with friends, significant others, and family members. The right to confidentiality. This means any information you may have in regard to the people we support must be kept in a secure area. Information about the people we support cannot be shared with anyone unless they are given their permission. Routinely offer the opportunity for people to review their records. The freedom of association. This means that the people we support have the right to choose their friends, the right to have intimate relationships with consenting adults, and the right to participate in activities of their choosing. Meaningful inclusion in the community should always be encouraged. The right to visitation. This means the people we support have the right to have visitors and/or visit others. There may be reasonable guidelines set on visitation. However, these guidelines must be approved by the supporting team if necessary. The right to vote. This means the people we support have the right to vote in local, state, and federal elections. How many people on your caseload are registered to vote? The right to medication. The people we support have the right to be informed about their medication, such as what it's for, the dosage, the frequency, the side effects, the benefits, and alternatives to the medication if there are any. The right to health. The people we support have a right to adequate health care, routine and preventative health care, the ability to voice concerns about healthcare providers, seeking support for unique needs, and advocating specific visit types such as in-person versus virtual. The right to refusal of treatment. The people we support have the right to refuse medical treatment. This includes medication and medical appointments. If a person refuses medication on the first attempt, ask them why and find the best solution that works for them. The right to informed consent. This means that people we support should be informed thoroughly before making a decision about medical treatment, allowing a photograph of themselves to be taken and released, allowing a videotape of themselves to be shot and shown, and allowing themselves to be recorded and the recording to be heard. Freedom of expression. This is the right to think and say what you want without fear of criticism. Find the best way to express yourself. You can use religion, speech and communication, cultural practices, music and entertainment preferences, clothing, political views, and voting. The right to self-determination. This means that the people we support have the right to make choices, which includes the choice to take reasonable risks. What are some good examples of reasonable risks? The right to safety. The people we support have the right to a safe environment, free from harm and abuse. This includes physical, emotional, mental, and sexual abuse. They also have a right to report abuse or mistreatment or receive help in doing so. Lastly, this is the right to receive a timely decision and the right to appeal that decision. The right to religious freedom. The people we support have the right to practice the religion of their choosing. If the person chooses to attend a different religious service than your own, it's the provider's responsibility to find a way to assist the person in getting to the service. It is also the right to attend any religious service they choose, and the right to not practice any religion is important to note as well. The right to least restrictive care. You cannot restrict the people you support in any aspect of their life unless stated otherwise in a professionally developed plan. Do not take away items or activities. Do not send the person to their room. Do not tell the person they cannot do or have something due to a behavior, and you may not punish a person for a negative behavior. The right to communication. The people we support have the right to make and receive phone calls, mail, and visitors. They also have a right to receive uncensored mail and phone calls. People should receive the assistance necessary to communicate. The right to personal property and finances. The people we support have the right to handle their own money unless a conservator or representative payee is appointed. They also have a right to acquire, possess, and dispose of possessions of their choosing. The freedom to marry, procreate, and raise children. The people we support have the right to have meaningful, long-lasting relationships. They have the right to preserve these relationships in marriage if they so choose. They also have the right to have and raise children if they so choose. The right to education. The people we support have the right to public education. A person cannot be excluded from public education due to a disability. The right to work and earn money. The people we support have the right to earn money at a fair wage. It's important to help those on your caseload find work and employment that is meaningful to them. The right to terminate services. This means that programs cannot terminate a person receiving services due to a problem without exploring every possible way to address the problem. This includes calling an additional ISP meeting to discuss and develop alternative plans to cope with the issue. A person cannot be terminated from a program for expressing their rights. Human rights concerns. As a supporter, caregiver, and advocate, you may encounter human rights issues. There are two types. An issue which constitutes abuse, neglect, or mistreatment and should be reported immediately to DPPC at 1-800-426-9009. Or an issue that can be addressed through the human rights system and with the help of the agency human rights officer, human rights coordinator, and/or the DDS human rights specialist.